Well, good evening, everyone. Thank you for joining us here tonight with Doctors in Politics. We're very fortunate today to have Dr. Rob Davidson, who's been an outspoken advocate and a leader for universal health care, explaining the necessity tonight for why physicians should become activists. And you might have seen Dr. Rob Davidson before because he had a viral video when he was questioning Mike Pence, I believe, at a diner in Des Moines, Iowa, about at the time, the Trump administration's push to cut Medicaid spending. And so it's been very important for us to get more Medicaid expansion and to get more funding for Medicare. And I'd love today to have Dr. Rob Davidson kind of explain, how he turned into an advocate and how he's become really an activist for all physicians. So thank you so much for joining us and take it away.
Thank you for having me. Really thrilled to be talking to this group. And, as the name of the group is, Doctors in Politics, I think it's appropriate that I would be speaking to you all. I've been a physician. I'm an emergency physician, been doing that for nearly 20 years now in rural West Michigan. And, probably as into politics as most people, or as some people, a lot of people on this call for most of my life, voted in every election, knocked some doors, gave some money. But really in 2016, got more concerned about the fate, particularly of Medicaid expansion in our state of Michigan. Fortunately, we've expanded Medicaid. I think now over 800,000 Michiganders have benefited from Healthy Michigan, our version of Medicaid expansion under the Affordable Care Act. And when Donald Trump was elected with a Republican House and Republican Senate, I became extremely concerned at their constant drumbeat of repealing the Affordable Care Act, and what I saw from them as their unsuitable replacements, I thought would really hurt my patients. I work in a county of 48,000 people, one of the bottom 10 poorest counties in the state of Michigan, and 8,000 of the 48,000 have received Medicaid under the expansion, under the Affordable Care Act. And I knew that those patients of mine that I've been taking care of for almost 20 years would then not be able to afford their inhalers or their insulin or afford to see a primary care doctor, or frankly, come see me when they had chest pain or stroke symptoms or any other potential emergencies. And so that got me involved, like a lot of folks perhaps watching this webinar and maybe involved in Doctors in Politics. In a fairly short time, I decided to run against my Republican member of Congress in a very red district, had been won by him and by other Republicans by about 30 points at every previous election. And what I will say is I dove right into it despite the odds. We built a very strong campaign. I will say at this time, anyone on this webinar considering running for office, send me a Twitter DM. I will not try to dissuade you, but I want to be clear, it is not for the faint of heart. If you're going to do it right, if you're going to try with everything you have to get your message to as many people as possible, to bring along both people who should be voting for you and for potentially other Democrats and yet don't always vote, and also people who maybe just aren't sure or maybe have never voted for a Democrat before, and you think that, hey, listen, my experience as a doctor and my passion for healthcare really could speak to those folks. What you need to do is raise money. So running for Congress, managed to raise about $1.2 million in a district that the most that ever been raised was about $100,000, and did this by frankly sitting on my butt, making phone calls about 40 hours a week on top of working in the emergency department and going to fundraisers and going to rallies and events. And so for about a year and a half of my life, that all consumed me. We ended up losing the race by 12 points, but made significant gains and really built an infrastructure in the district. And while doing that, I started working with a group of individuals that on their own had started an organization called the Committee to Protect Medicare, and that Committee to Protect Medicare and the Affordable Care Act at the time. And really, they had the same idea when Donald Trump and Republicans took control of our government. They were very concerned about the potential repeal of the Affordable Care Act. We all concur that we need universal healthcare. We need to have everybody have affordable healthcare. But we also knew that the Affordable Care Act made some serious strides, particularly with the Medicaid expansion. And they were running primarily a Facebook page, a small email list, raising just maybe $50,000 in a year to be able to put out content, letting people know what Republicans were doing and what that would mean for them, particularly around the protection of pre-existing conditions. And after my campaign ended, the people who started that approached me and said, "Listen, you've been a good messenger about healthcare. You know, as a candidate, you are by nature an advocate and an activist all rolled into one." And they thought, "Hey, we could maybe turn this organization into something where we can elevate the voices of doctors who are interested in policy for sure, and certainly want to do what's best for our patients, but believe that a very significant path to doing that is in the political arena, frankly." I don't know as much about policy as I should, and I'm currently enrolled in an online Master's of Public Health program at Michigan, trying to learn more, trying to build a better foundation in public health, particularly with the pandemic that we are all enduring. But I do know politics, and I think a lot of the folks watching this probably do too. I do understand that doesn't matter how many wonderful policies you conjure. It doesn't matter if you're right, frankly. It doesn't matter if you know you're right and the people around you know you're right. If you can't get people elected who will vote for those policies, it just doesn't matter. And so we have built an organization across this country. I think now we have doctors in 50 states. Throughout the presidential campaign, we raised a couple of $1 million through just small online, through email fundraising, and then ran ads featuring doctors talking about why healthcare was important to them, why they were fighting for healthcare for their patients. Frankly, telling the stories of that we know, anyone in healthcare, whether you're a medical student, resident, doctor, nurse, all of us. I just talked to a new organizer we hired who did some pre-med and shattered an orthopedic surgeon. She was an immigrant from India and came to America because she wanted to get training, she wanted to get educated. And the first room she walked into was an African-American man who had just had his leg amputated. And the surgeon said he had that amputated because he couldn't afford insulin, couldn't treat his own diabetes. She was just shocked that this was healthcare in America. And we all know too well that is a big part of healthcare in America. If you can't afford it, you end up getting your leg amputated 10 or 15 years down the road, or you end up having a heart attack or a stroke because you didn't control those diseases. And so, you know, we built this organization. I think we had a significant impact in battleground states, now building out capacity in states, fighting for healthcare policies in states. And also, now that we have a Democratic Senate, we'll be fighting hard to get the expansion of healthcare that we think we need on the national scene. And, you know, to me, I'm almost 50 years old. I'll be 50 this year. I got into this about 4 or 5 years ago now, and a bit late to the party for being an activist. But I think the reality is we all are advocates every day in our jobs. We're advocating for our patients all the time. And we all see the injustice of the American healthcare system. I know I see it in a rural emergency department with people with copays that are $250 or $500. In particular, a patient who came in 3 times in 5 weeks with vomiting from chemotherapy. And the third time he had to be admitted, he was quite dehydrated and looked quite ill. And I asked him why he waited so long to come in that third time, so we couldn't just tune him up and send him home. He said, well, it's $250 every time I come in, and that's a lot of money. That's, you know, that's groceries, that's real dollars. So as we advocate for our patients and we see the injustice, I think it is natural that we are compelled to become advocates and, frankly, activists on a bigger scale. Doing that through groups like Doctors in Politics. For those of you who choose to run someday, it is a worthy endeavor, win or lose, hopefully win. It is, again, not for the faint of heart. But even if you don't want to run, if you want to get involved in organizations like this, you know, like the many other advocacy organizations, or frankly, like Committee to Protect Medicare, who is taking this fight of talking about the injustices of healthcare and advocating for our patients and bringing it to the political arena. So I won't ramble on anymore on my own. I've taken up a bit of time, and I'd love to answer any questions that folks have. So I think Justin was going to hop on and maybe ask the questions, or I don't know if I should just read them myself and answer them.
Yeah, one of the questions here is, what suggestions do you have to move doctors from advocacy to politics?
Yeah, I think you look for organizations that are doing the work you want to do. So Doctors in Politics is certainly working to get more physicians running for office, I believe, is a big part. And so teaming up with organizations that are already doing that work. Again, organizations like ours, the Committee to Protect Medicare. If single payer healthcare is your passion beyond anything, the Physicians for a National Health Program certainly is doing advocacy, although with less political focus because of their nature as a 501c3. Our group is a 501c4 with an affiliated political action committee. Also now branching out and starting a C3 to do more policy advocacy. If a range of issues is your passion as a physician, Doctors for America certainly is advocating for affordable healthcare and expanding healthcare, but for other issues of social justice that we know touch our patients every single day related to the social determinants of disease. So yeah, I guess at this point, you don't want to go it on your own. There are groups out there like mine, like the one, the Doctors in Politics group, DFA, PNHP, that are doing great work that I know have a place for all of you.
I don't know if you see that question.
Yeah, so the question is, how did you figure out how to start fundraising? Political fundraising isn't something they tend to teach in medical school. Well, I went to a training for candidates put on by the Progressive Change Campaign Committee. And you learn about making your elevator pitch, a 30-second call. You practice with other people how to basically ask people for money. And we reached out to grassroots organizations in the district that we thought would be aligned, both Democratic organizations, but also just groups like Move On and others. Meeting up with people, having small fundraisers to raise money, to then have a confidence to hire a fundraising consultant. And that kind of that's the final thing you need to get to. Hire a fundraising consultant, particularly someone you can work with that sees the potential in you so that they know you can do the work to be able to eventually pay their bills, but then also pay for a robust campaign. But you're right, it's not something they teach. And it's the most unnatural thing you'll ever do in your life, unfortunately. The point at which I became the most discouraged with running for office was probably in July or August of election year, when I sat down to call time for about 6 hours and it wasn't uncomfortable. And I felt like I was getting good at it. And my call time manager was a retired pilot, Air Force veteran, sitting there with me. And I looked at him, I said, Chris, this is kind of sad, but this didn't feel awkward today. And honestly, you need to get to that point, but it's the moment you realize how absolutely broken politics is, and the need to sit and call people for money is part of that broken system, and it needs to be reformed, and we should be fighting for that. But until it is, we have to be able to play on the same field as everyone else, so you have to do it. Favorite thing, I'll just read them here. The favorite thing about running for office, I think it was two things: telling the stories of my patients in a HIPAA compliant manner, but telling those stories that really connected what I was doing with the people to whom I was speaking, with the audience. I believe both with advocacy for healthcare expansion in general, and within the current pandemic and the COVID crisis, which my organization has, and I have talked about a lot and advocated for, mask policies, advocated for better testing, now for vaccine compliance. But the stories we tell are really the powerful piece of the narrative that we can bring to the political arena as doctors. I have two senators here in Stabenow and Peters who are Democrats who believe in healthcare, believe in expanding healthcare. They don't have those experiences. All of the members of Congress in my state don't have those experiences. You do, I do. And that is powerful. Anecdotes move people much further than statistics, frankly. We trust statistics. Every day in your job, you're taking complicated information, complicated ideas, and years of research into certain drugs, into certain therapies, and you have to distill that for your patient at the bedside. Well, we can do that as well, but I think also telling those stories and amplifying those stories. The two most valuable things that I learned during my run for office, I think, you have to raise money. We were able to be up on TV in a very strong way with many points, and you'll learn about what points are. It's basically how many viewers you get in your local market. And we were able to be up very strong about 7 weeks out from the election. I wanted to be out about 9 to 10 weeks, but we got up 7 weeks out and really saw the needle move again. we had a poll. I was within 6 points with about 4 or 5 weeks to go. Ended up being a 12-point, a big surge of Republican voters, if you remember, in 2018, in addition to all the Democratic voters. So I think that was a valuable lesson. I think the other piece, find your plan, find your core messages. For me, it was certainly healthcare. Also, live right on Lake Michigan, or right near Lake Michigan, and my district is along the lake, and the lake is a huge issue for people around here. And then education. I was a school board member. I'm a father of 3 kids of public schools, product of public schools. Try not to follow too many shiny objects when you're running. There will be issues that come up. There will be people who are passionate about the issue they care about most. Maybe don't hold a press conference about those issues that aren't part of your core message. Certainly there are exceptions, but you do find it's easy to get kind of go down a path and not be able to find your way back. So I think that's another critical thing. One other, how did your issue advocacy priorities and political activism change during COVID? Yeah, that's good. Thank you. During COVID, I think it's shown a bright light on the disinvestment in public health in this country over the years. I think less than 3% of all healthcare spending in this country right now, just learned that in the class I'm taking, is spent on public health versus healthcare in general, drugs and tests and doctors and hospitals. And we've learned that we don't have nearly enough folks out there working to do testing and tracing. I know in one of the bigger counties in West Michigan, Muskegon County, I think it's a county of about 150,000 people or so. There are 8 full-time employees at the county health department, and they are trying to do testing and tracing, now trying to roll out vaccines. And of course, you are setting yourself up for failure. And so I think advocating not just for affordable healthcare, but advocating for public health, which is part of that, advocating for those issues that speak to the social determinants of health, like housing, like food insecurity, environmental health. These are all issues directly connected to what we do every day on a grander scale. I think the people who can, work in vaccine research, or people who can get a public health campaign out, particularly getting people to get their kids vaccinated, or to wear bike helmets, or whatever part of public health you pick, they're going to save more lives than any of us will in a career seeing patients at the bedside one-on-one. It's just a reality, and we need to advocate for funding of the people who want to do that work, and some of us also do that work because I think that again has been shown. The other piece I think that has been unfortunately kind of shown brightly to us is that there are such huge disparities based on race and ethnicity in this country when it comes to healthcare. The mortality rate of Black and Brown people in the pandemic from COVID-19 is 3 to 4 times that of white people. I'm concerned now because of vaccine acceptance in Black and Brown communities is seeming to be so far less than those in white communities for very good reasons. There's a distrust of government, distrust of the healthcare system. We need to do better. We need to spend more time intentionally working on those issues, both as individuals in those communities and as allies of those communities. So yeah, that would be probably during COVID how those priorities have shifted, or at least become clearer to me.
Well, thank you so much. It was a pleasure having you here tonight. Sorry, my audio's on. It's just coming out weird. But
okay.
Thank you so much for having us tonight, teaching us how you were a great advocate.
All right, thank you. Appreciate it. Keep doing the great work. Look forward to working with you guys down the road.
Thank you.
Bye-bye.